So now comes the anterior oblique sling, which is formed by stance leg or weight bearing leg adductors and the same side internal obliques and the opposite side external obliques. So it goes this way. Adductors of the same side, then of the same side internal obliques, and this side opposite side external oblique. So let's see in detail. Starting from down to up. So we'll be starting from down to up. So first adductors of stance leg, then of same side internal obliques, and then from here to the opposite side external oblique. So adductors we know, as they also participated in lateral sling, and we can also see them in anterior oblique sling. So they are attached to medial proximal tibia as well as medial side of femur and to pubis. From here, this anterior oblique sling, starting with this adductor, as we saw the attachments, it is traveling upwards to the same side internal oblique. So here we can see now adductors ended to pubis. Now from pubis we have attachment of internal oblique at pubic crest and also at iliac crest upwards, and then to the costal cartilage of 8 to 12 ribs. So this was from pubis to iliac crest to the costal cartilage of 8 to 12 ribs, and from here it will be to the contralateral or opposite side external oblique. So again it will have attachment. This is the opposite side external oblique, so this side will be the internal oblique and this is the external oblique. So we have attachment at anterior rectus sheath as well as the iliac crest and pubic crest, and along with that to the anterolateral border of lower 8 ribs. So that was about adductors of stance leg, then of same side internal oblique and opposite side external oblique, forming the anterior oblique sling. So here we can see that anterior oblique sling contributes to stability and swing phase in gait and acceleration or deceleration or changes of direction in movement. So these three group of muscles, adductors as well as the internal and external oblique of same side, external oblique of opposite side. So these will contribute to stability and swing during the gait as well as speeding or acceleration or deceleration or any change in direction while performing the movement. So as for example, crawling activity will rely on this anterior oblique sling, which will comprise this adductor, internal oblique of same side as well as external oblique of opposite side. So that is the anterior oblique sling. So this was a small but important fact how in gait in swing phase or while acceleration, deceleration or changes of direction has to correlate with this anterior oblique sling, or anterior oblique sling has a great role to play in that. Now let's see about posterior oblique sling. Is formed by what group of muscle or what muscles? So it is possibly two muscles connected with fascia in between. So again from down to up we have gluteus maximus and upwards is lat dorsi of opposite side, and both are connected via the thoracolumbar fascia. So we can appreciate gluteus maximus over here. So if one side gluteus maximus muscle is considered, we have the attachment at gluteal tuberosity and the ilium. So this is the attachment of gluteus maximus. Now this side gluteus maximus there, and then in the center we will have thoracolumbar fascia, and the opposite side lat dorsi. So we have the attachment again at iliac crest and the thoracolumbar aponeurosis, as well as the inferior angle of scapula, T7 to L5 vertebra, and the bicipital groove of humerus. So this way, from the opposite side G max or gluteus maximus, if we consider this side, then the contralateral to it, we will have to consider the latissimus dorsi. So this way, posterior oblique sling travels. And the gluteus maximus and lat dorsi, as discussed, will be connected via the thoracolumbar fascia in between. And as we can appreciate that thoracolumbar aponeurosis forms the attachment for latissimus dorsi. So it blends with this thoracolumbar aponeurosis. And here is the TLF, thoracolumbar fascia, and this side we have our gluteus maximus attached to ilium as well as the gluteal tuberosity. So that was about the posterior oblique sling.